Alright, this is a video on what you're going to do during your medical assessment, and we're going to cover each individual point and what you'll need in it. So for your medical, you're first going to start with appendment. So PPEs, BSI, so it's going to be your gloves, goggles, anything else you might need. Next, environment, so scene safety. Make sure your scene is safe to approach. If it is not, do not enter. Then you have NOI and MOI. So nature of illness. So since it's a medical call, you're most likely going to be doing nature of illness as your appendment. Although MOI, mechanism of injury, may occur in a medical assessment. Next is additional resources. So if you need PD, fire department, or ALS, you're going to call for them at that point. And then finally, number of patients. So how many patients do you have? Next, you're going to move into ceasefire precautions if necessary. If it is a medical complaint, you may not necessarily need to use them, but do keep in mind if you come to a scene that a fall has occurred, you may need to use ceasefire precautions. Next, you're going to, based off of that, you're going to determine your general impression of life threats. So, how sick is my patient right now? Is my patient really sick, or are they not that sick at all? So that's going to determine if you're going to go really fast to the hospital right away, or if you're going to have a little more on-scene time. Remember, you're trying to aim for about a 10-minute on-scene time for critical patients because you want to get them in and out. At that point, you're going to start going into your primary. Your primary is going to consist of AVPU, ABCs, chief complaint, and transfer decision. So AVPU is my patient alert. If they are alert, make sure they are A&O times 4 or something like that. They may be less, make sure you record that. Verbal, they're only alert to verbal. Painful, if they're alert to painful stimuli. So it could be a sternal rub, or you could pinch on the shoulder. And unconscious, the patient's unconscious and doesn't respond to anything. Next, you're going to run into your ABC, so airway, breathing, circulation. Does my patient have a patent airway? If not, you're going to address that right away. Breathing, are they breathing adequately? If not, you're going to have to start bagging your patient or use additional methods to secure that airway and breathing. And finally, circulation. Does my patient have a nice, strong pulse? If not, once again, you want to address that. After you do that, you want to make sure you get your chief complaint from your patient. So you may ask, sir or ma'am, what seems to be bugging you today? What can we do for you? And you're going to work into your secondary based off of that. And then finally, after that, transfer decision, going fast, going slow, based off of all that. It's important to note, too, during your primary, that's when you get the patient's first name, last name, the birth date, and additionally, any other information that might be necessary. At that point, you're going to move into your history. So you're going to get a sample. So symptoms, allergies, medications, past pertinent medical history, so anything that could be important to that. So heart surgery, anything related to that. L, last oral intake, so when's the last time they ate, when's the last time they drank. You want to make sure you record that because that is very important for certain medications and just overall depending on what their injury is. And then finally, you're going to go to events leading up to the incident. So what were they doing? Were they just not doing anything at all, or were they trying to do something that led to that injury? And then based off of what the chief complaint was, you're going to do an OBQRST, so onset, the onset of pain, provoked, and palliation. So does something make the pain better or worse? And then quality. So on a scale of 1 to 10, how bad is the pain? They may say a 5, they may say a 10. If that is a 10 in that case, you want pain management of some sort. At that point, radiating. Does the pain radiate to any region? So you can use palpation, determine if the pain goes anywhere else. And then severity. You want to see what the severity is. Time. How long has the pain been going on? So it could be days, could be hours. And then has this ever happened to you before? Next, you're going to run into your secondary. And your secondary is going to be your review systems based off your chief complaint. So in a trauma assessment, you're going to do a full body. In your medical, it's going to be based off of what you're complaining of. So if your patient is complaining of chest pain, you're only going to, or not entirely, but you're going to mainly focus on the chest and any systems related to that. After your secondary, you're going to run into your vital, so get a full set of vitals. And then you're going to go into your interventions. So if you need to do O2 or medications, anything like that, you can do that. After you've done your medications or interventions, you are going to reassess vitals to see if that affected the patient at all. Then reassessment en route, so constantly checking on your patient, making sure they're okay. If there's any changes, be sure to note that. And finally, your radio report to the hospital and on-call med. So radio report we'll cover in a separate video, but otherwise this is everything you need for a medical assessment.